Hello and welcome to HSM 410. Today we are going to be discussing human technology interface. And this is more of a bit of an FYI. This is the last module for this course, and the lecture is going to be a bit shorter than previous ones. So let's get into it. There are three learning objectives for today's topic. We are going to, be describing what human technology interface is. We're going to describe some of the challenges and problems that comes with human technology interface, and then finally, we're going to kind of discuss a little bit about the future of human technology interface. Well, kind of a bit of a speculation there. Anyway, so what is human technology interface? So, a way to kind of describe it, to put it simply, is the interactions that humans, especially healthcare providers, are having with technology. As you guys know, modern medicine has involved a lot of technology coming in, and with AI that is being used in healthcare delivery and data mining and big data and all of that. There's a lot of technology that has been incorporated in medicine and in care delivery. So all of that, the way that human healthcare providers are interacting with these technologies are all part of the human technology interface. So and this includes the hardware, this includes the software, in whichever way that human healthcare providers as well as patients are interacting with this technology. And this could be, how information is presented in text, in numbers, in icons, voice activation, digital pens, even keyboards. So these are all parts of the human technology interaction. A very good example is one that we've talked a bit in this course. We talked about electronic health records. That would be a good example of a human technology interface, but we're going to kind of mention other ones, but that is a good example of that. So, how successful we view human technology interface does not only depend on how beautiful the design is or how advanced the technology is, but it looks at it in terms of how well is that design meeting the needs of the users, the end users. The end users here could be the patients that are going to use it, but as well as the healthcare providers that are probably going to interact with it much more and probably on a daily basis. How does that meet their needs? And which means that designs have to account for other things beyond just the technology or what the that device can do. It has to account for human factors, which could include whether the person is any healthcare provider is open to using the devices, because some people are early adopters of technology. Whenever something new comes in, they are very, very quick to jump on it, and they're able to integrate very seamlessly with new technology. Some people are not. Some people need a bit more convincing before they can. So that would be a form of human factor in it. But then you also have the workflow, because sometimes with the introduction of new technology, it disrupts an existing workflow. You could be say before the introduction of the technology, healthcare workers are going from A to B and B to C, C to D. But when the technology comes in, suddenly they're having to go from A to the technology and then from technology to C, and the whole B workflow is kind of phased out. It may look like, oh, this is a good thing, but remember, the people who have already gotten so used to going from A to B to C have to adjust to the change, and that can interrupt flow, because it can also introduce a number of unforeseen circumstances, and some of them would not be kind of ideal. So these are all examples of human technology interface. We've kind of talked about the human electronic health record, but also I want to kind of talk to you guys a little bit about the telehealth system. There was this digital health conference that happened in Southeastern. I think it was in September, or was that in October? But anyway, what happened was there's a lot of companies that came to Southeastern to talk about the fantastic things that they were doing with technology, digital health, and all of that. And one of them was advertising their tele-nurse system. So what happened with this tele-nurse system was that they had a some kind of an outstation nurses point where they had a couple of nurses who were providing care to multiple healthcare providers or healthcare sites, hospital sites and all of that. So what happened with the hospitals that were all part of that system is that they had some kind of a screen in the rooms of the patients. And what happened was that when the patients press a bell, push a button somewhere in their rooms, the nurse is going to come up on the screen and talk to them. So as against a nurse coming in from wherever their post is and trying to talk to the patient, this nurse is stationary, is in one place, and it just pops up on the screen and talks to the patient. So in a way, with that, you can be sure that there's something like a prompt response from the nurse, because this person is stationary and very likely that they will be able to answer the patient very quickly. But what also happens in this case is that there is, this telenurse doesn't have the opportunity of using every other system senses to kind of feel the place. Is not necessarily having the touch, being able to see the patient up close and see what's going on with them, be able to touch them, and all of those. So that's kind of what is lost as a result of it, which is basically what happens with when technology is introduced. A lot of things are gained, but some things are lost as a result. So, which then brings us to the second learning objectives, talking about the problems of human technology interface. So, there are a lot of problems. As much as there are, good things that happen with introduction. So, let's off the bat, let's say the problem is that design was poorly done. So you can have a situation whereby the design of the technology was very poor, it was very poorly done, and therefore it will lead to a lot of errors. It could lead to low productivity, or depending on how bad things are, you could just reverse the whole thing and say we don't want this technology thing anymore. Let's go back to the way things used to be. But some of the times, the challenges that come up as a result of the human technology interface goes beyond how well or how poorly the technology was designed. A lot of the problems that come up as a result is very much in terms of the technology is not faulty, the technology is fine. Where the problem is that they kind of not meshing well with the humans. So there's a mismatch between the users and the context of care as well as the technology. So the technology is is flawless, is performing the way that it was designed to perform, but it's not well matched with the users, or it's not well matched with the context of the care delivery that needs to be done. And then some of the times, this, because of this not being out of sync, we kind of leads to human errors, and therefore a lot of problems in the care delivery. So, and one of the reasons that this happens in terms of the mismatch with the technology and the human beings that are going to use it, or the context, is that for like I said in the last module, how research is being done in a controlled environment, the same as technology. Usually, technology is being designed and tested in a controlled environment. The environment in which it's being designed, the environment in which it's being tested, is not at all like the real life situations. I talked mentioned to you guys how it's going to be very difficult to carry on research in a place where with a very high pressured highly volatile environment of a hospital that is working at full capacity, that makes it difficult to actually carry out a research because of all the unpredictable how high things can go wrong. Same with designing or testing technology. It's very difficult to do that in a real life situation, because research ethics and also design ethics means that you have to account that you have to account for the that no harm is done to the humans that are going to be part of it. The benefit must always outweigh the harm. And when I mean harm, I mean harm to the person, not like harm to the overall system. If the benefit to the person is a lot smaller compared to how much harm it is, then research ethics or design ethics is not going to let that happen. So because of how much we have to account for the care of the human patients, it's very difficult to design technology in a real life situation. So because of that, the challenges of coming up with design and finding out after implementation that it is mismatched with the people who are going to use that technology, or with the care delivery, is a challenge that comes up with human technology interface. So, an example of a poor interface would be, in this case, where you had a patient that received psychiatric medicine almost 2 weeks after that the person was supposed to receive it. And the reason why that happened was the computer of the pharmacist had been designed such that it can automatically discontinue an order of a certain drug. However, it wasn't built to notify the patient's care team that this has happened. So the patients kept kind of thought, okay, I'm no longer receiving this medication. That means I have reached wherever I was meant to reach. So that could be an example of a poor design that didn't account for what's going to happen as a result of what it's performing, what it's was designed to do, because the system was designed to discontinue it, but was not designed to alert the rest of the care team that this is what has happened. So that's an example of a poor interface. So, which means that when it comes to the design and implementation of a human technology interface, the right processes has to really take into account an understanding of devices itself, as well as the understanding of the users. And I mean both the primary users and sometimes the unforeseen secondary users that would come up. So this is all the things that has to be accounted for. An example of the implementation of a human interface technology would be the CPOE implementation. CPOE is a computerized provider order entry. This is an application that allows healthcare providers to kind of use computers to directly enter medical orders into the system and do that electronically. So, what happened in this case study that I have here was that I think this was sometime in 2005 when the CPOE was introduced, and it changed the workflow of the emergency room. So it used to be that there's a radio communication to the hospital that, oh, we are coming in. The transport team was coming in with a child. This happened in a pediatric hospital. We're coming in with a child to let them know and get everything ready. But when the CPOE was implemented, that whole part of radio communication was kind of phased out. So what then happened was that the system kind of happens when the patient has arrived and is registered into the system. And then you had some technological errors with some of the others requiring 10 clicks or even taking as long as 2 minutes to be able to enter the information. And then you had, sometimes a computer screen freezing, or sometimes a response time being slow. So these were the things that they did not know at the time that it was designed, but they became aware of these challenges upon implementation. So in this case, they were able to work out the kinks or the things that weren't working well during the implementation and the evaluation of the implementation, and some of those problems that were discovered after implementation were solved. This doesn't happen all the time in all cases. In some cases, the technology is discontinued before it even goes through the process of, kind of discovering all the things that could potentially go wrong and solving those problems. Sometimes it just doesn't go through that. So, what there is a balancing act when it has to do with human technology interface, and the reason is because there's so many things that technology has to account for, or really take into consideration when it comes to making sure that the human technology interface process has been very worked out, and making sure that everything works well. You have the physical in terms of who is going to physically operate this technology in cases where that's needed. You have the psychological. I kind of mentioned earlier that there are people who are early adopters of technology. Some people are not early adopters. Some people kind of want to wait a little bit until everything is proven that everything is fine, nobody's dying from using this technology, then they can then kind of give it a try. But that is something to consider that comes into when it comes to using technology. Then you have some of the teams. Some teams are more willing to try something new, knowing that this may be we may go through some teaching process, but afterwards we're going to get it right. Some teams are a bit more conservative in that sense, or they may feel that we have too many things on our hands, too many unpredictable things on our hands. We don't want to add technology to that. And then you have organizations. Some organizations are more willing to try things out and see where that would work, and some organizations are not quite like that. And then you have the element of politics that comes in. I don't want to use examples in this case, but we could just imagine in situations where politics can come in, and suddenly something that sounded like a good idea get campaigned against, and then it's not so good idea afterwards. So one of the things that human technology interface also has to kind of pay attention to is the fit between the individual, the task that needs to be done, and the technology itself, which is the fit. And it requires that there has to be an evaluation, in the design and evaluation of the technology, is looking at how does this technology fit in with the individuals, how does this technology fit in with the tax, and how does all of that fit in with what the technology has been designed to accomplish. And this is an illustration of the balancing act to kind of show all the things that human interface having to deal with. So, what is the future of human technology interface? In an ideal world, every technology interface will be designed to enhance user workflow, and does so. It will work as easy as human ATM. Sorry, work as easy as ATM machines, but then that depends on who is using the ATM machines. But that's an example. It will also be fully tested prior to implementation in settings that mirror the real life settings in which it will be used. This is not something that we can achieve just yet. So there are a few promising things that has happened in that area. We have the Hover technology coming from Samsung. We have the Your Body is the user interface, whereby there's a use of body language expressions as a way to communicate with technology. And then we have the hologram, in which we have our devices talking to each other by mirroring or understanding our, the past things that we have done, and being able to say, okay, this is how this has been behaving all of this time. I know this is the way that it's going to behave, and be able to make these predictions and actually carry them out. So that is it for today. If you have any questions and you need any clarification, please use the Q&A board, and I will see you soon. Have a nice day. Bye.